when to go to the hospital as a person, a caretaker with this child who has sickle cell disease. When do you go to the hospital? In our book, we say that sometimes managing sickle cell at home is enough, but there are moments when it is too risky to wait. Knowing when to seek medical help can save the life of this person with sickle cell disease. And in this chapter 5 of this book, we are looking at how and when to take action without delays or without guessing. Signs that you should look at to ensure that you go to the hospital as early as possible are outlined in this book. And one of it is high-grade fevers. Fevers above 38 degrees centigrade or 100.4 degrees Fahrenheit. It is a sign that you need to go to the hospital, or you need to take this child to the hospital, because fever can be a sign of an infection, and infection can get dangerous. It can get dangerous quickly in people with sickle cell disease. That's why children, especially children, need urgent attention when they develop fevers. So don't just give Panadol and wait to these children. Go straight to the hospital when you notice those fevers. It is hard for sometimes mothers to tell whether the fever is above 38 degrees centigrade, but sometimes these days we have thermometers and mothers know how to use them. Or they try to see the temperature of the body, but sometimes you cannot know, but sometimes mothers can really know when the temperatures are really high. Another way to know when to go to the hospital is when the child has breathing problems. If the person is breathing very fast and hard, complaining of chest pain, having cough, with fever, please go to the hospital. Don't give the home remedies that we have talked about, because this could be a sign of acute chest syndrome, which is a serious complications similar to that of pneumonia in children or people with sickle cell disease. So when you notice that, please visit the hospital. Another sign in this book, we talked about severe pain not improving. If you have tried pain medicine, warm fluids, rest, but pain keeps getting worse or spread, it is time to go to the hospital. The person may need stronger pain relief like IV fluids or even oxygen, may need strong painkillers, morphine, So when you see the pain has not improved by your painkiller that you have home, maybe ibuprofen, maybe Dynapar, any of them, please visit the hospital, because that can be a sign of a chest pain syndrome, which is a very serious complication in people living with sickle cell disease. Swollen abdomen, please visit the hospital when you notice that in a child with sickle cell disease, because a rapidly growing and painful tummy, especially on the left side where we have the spleen, could mean a spleen is trapping blood, a dangerous correction called spleen sequestration crisis. So this can be deadly if not treated quickly, especially in children. So when you see the abdominal swelling so fast, especially on the left, where we know the spleen is there, it means the spleen is pulling the red blood cells, these sickle cells in the spleen, and at a very fast rate. So this child needs urgent attention. Sometimes they do splenectomy and remove the spleen. At times, it can be a call for surgery. If you see this child is having unusual sleepiness or confusion, please visit the hospital. It can be a sign that needs doctor's attention. And if sometimes the child is very tired, can't stay awake, seems confused, could be a serious issue that maybe the oxygen is going low. So and it involves even the brain. So you need to visit the hospital as early as possible. Sometimes severe headache, blind vision, weakness. This could be a sign of stroke, and children and adults with sickle cell disease are at higher risk for stroke, and do not delay. It is an emergency that needs an emergency attention. Still in chapter 5, we talked about that don't wait until it is too late. And under this theme, we said many people in our communities fear going to hospitals because of the costs and long lines, or even bad past experiences. So they end up hiding away from the hospital. But we are telling you in this book that don't wait until it is too late, because the child can die, or this person with sickle cell can die. But sickle cell is not a disease you can always wait out. Early treatment means fewer complications and often a shorter hospital stay. You may take a very short time if you really go early without complication. So, what to carry when you are going to the hospital? If possible, pack the following: previous medical records or sickle cell ID card. Carry it as you are going to the hospital. Any medication the person has been using, those folic acid, penicillins, Fansidar, carry all of them and go with them to the hospital. Clean drinking water, because this child will need to drink water, or this person in sickle cell will need to drink enough water. So carry your water, or be ready to buy water. Warm clothing like blankets, please. When you're taking this person to the hospital, carry them. It's important. That's how the beauty with this book. I'm highlighting things that really, if you read all my book, you'll be able to take care of these people living with sickle cell, or this child living with sickle cell, in a very good way, and they can really live a happy life and live like any other person. It is a myth that people think that people with sickle cell die early. It is not true. We have seen people who live up to 80 years, even, and live normally like any other person, provided these simple details that I'm talking about are taken in place. Therefore, in the next chapter, we will look and explore the daily habits, like what to eat, to live, that can help this person to live and help them to reduce their sickle cell crises and improve on their overall health. That's what we shall be looking at in our chapter 6. So be eager to listen to our chapter 6. We shall be able to give you those simple details that you really need, the daily habits. Daily habits.